Federal officials issuing some stunning announcement yesterday. First and foremost, the intensity of the outbreak in New York City seems to be the most concentrated in the entire country. Yesterday, they're asking anyone who leaves New York City, whether you're going to a different state, which they don't recommend, or even just heading out to the east end of Long Island, they're asking for you to self-quarantine for 14 days. CBS News' Reena Roy is live for us at the Javits Center this morning, a scene that is still incredible to see. Reena?
Chris, good morning. Governor Cuomo says the rate of new infections is doubling every 3 days. So the Javits Center here will be transformed into a hospital over the next week or so, with at least 1,000 beds here. This as the White House considers getting the nation back to normal sooner rather than later. President Trump is aiming to reopen the economy by April 12th.
Easter is our timeline. What a great timeline that would be.
That's in about 18 days. His comments come as members of his coronavirus task force are now calling for a 14-day quarantine for anyone who has left New York.
We remain deeply concerned about New York City and the New York metro area. We are starting to see new cases across Long Island that suggest people have left the city.
Health experts caution the data just isn't there yet.
I think it's too soon to say where we'll be by Easter, but I think it's going to take at least until Easter to even begin to see the impact of the social distancing measures that have been put in place in the last week.
The president and his top infectious disease expert say that timeline is flexible and may not affect the country as a whole.
There are areas that are very different from other areas of the country. You may not want to essentially treat it as just one force for the entire country, but look at flexibility in different areas.
Governor Cuomo and Mayor de Blasio believe the worst is yet to come.
The notion that we could be, quote unquote, back to normal in the month of April is absolutely inconceivable at this point.
We haven't flattened the curve, and the curve is actually increasing.
With nearly 1 out of 4 New York coronavirus patients in intensive care, Cuomo outlined a desperate need: 40,000 more ICU beds and 30,000 ventilators.
FEMA, from the national stockpile, shipped 2,000 ventilators to the state of New York, and tomorrow there will be another 2,000.
But for the governor, it is not nearly enough.
Who picked the 26,000 people who are going to die?
Now, officials warn this crisis will likely have a grip on our city for months, with April and May expected to be even tougher than this month. We are live on the west side of Manhattan this morning. Reena Roy, CBS 2 News.
Okay, Reena, thank you.